seminal fluid analysis. Subfertility is the failure to conceive even after having regular unprotected intercourse for at least 12 months duration. Subfertility can be either primary, in which case the couple has never conceived, and secondary subfertility, in which the woman has conceived in the past. There are several causes for subfertility. It can be due to problems with either the male partner, the female partner, or in some cases both. In females, the causes can be categorized as ovulatory disorders and structural problems. Ovulatory causes can be a disorder anywhere in the hypothalamic pituitary ovarian axis. Structural causes are disorders which could affect the patency of the uterine tubes and structural disorders of the uterus itself. In males, the causes for subfertility can be categorized as problems with sperm production, problems with erection, and problems with ejaculation. Genetic disorders such as Klinefelter syndrome can also cause subfertility in males. When a couple presents due to subfertility, you must take a thorough history, examine both the male and the female, and do the necessary investigations next. This way, the cause for subfertility can be narrowed down. In females, we can perform the blood hormone profile to identify any issues with the hypothalamic gonadal axis. It also aids in measuring the ovarian reserve. Transvaginal ultrasonography is helpful to determine whether any structural lesion in the uterus is present or not. Hysterosalpingography, hysterocontrast sonography, or laparoscopy can be used to assess the tubal patency in the females. In males, the main investigation we perform is the seminal fluid analysis, which will be the focus of today's video. Before we dive into how seminal fluid analysis is done, we will focus on the method of semen collection first. Before collecting the semen, we must ensure and advise the patient that he must be fever-free or not have taken any drugs recently that could affect the motility of the spermatozoa. He also should not have ingested alcohol recently. The minimum time period of abstinence from sexual intercourse and masturbation should be 2 days, and it should not exceed 7 days as it can lead to poor motility in spermatozoa. The subject is provided with a wide-mouthed, screw-capped, sterile, non-toxic plastic container. He is then provided a place with adequate privacy to collect a sample of semen by masturbation. Ideally, this should be done in the laboratory itself. If not, after obtaining the sample should be brought to the laboratory as soon as possible. The necessary details for identification of patient, time of collection, and the temperature in which the semen was collected is noted down. Now that we have a clear idea of how to collect semen, let's take a look at what we look in a semen sample. In the macroscopic analysis, we check for the color, volume, viscosity, and the liquefaction time. The semen sample should be ideally a viscous, grayish-white, and opaque liquid. It should be more than 2 milliliters. The liquefaction time is usually between 45 to 60 minutes. In the microscopic analysis, the following parameters are measured: the sperm concentration, which is on average 15 million per milliliter; the total sperm count, which is on average 39 million per ejaculate; the motility, the total being more than or equal to 40%, and the progressive being more than or equal to 32%. Vitality, which is more than or equal to 58%. White blood cells, which on average is less than or equal to 1 million per milliliter. Normal forms more than 4%. And the pH, which is usually between 7.2 and 8.0. These are the various morphological forms that can be seen in a semen sample. When we talk about the motility of sperm, there are 2 types: progressive, in which the spermatocytes are swimming in a straight line or a large circle, and non-progressive, where the spermatocytes are swimming in small circles. This is important as the progressive sperm are the ones that have a higher chance of fertilizing an ovum. There are 3 abnormalities that can be seen in a seminal fluid analysis report. When the sperm count is less than 15 million per ml, it is known as oligozoospermia. When the total motility is less than 40%, it is known as asthenospermia. When the normal forms are less than 4%, it is known as teratozoospermia. Usually, all 3 pathologies occur at the same time, which is collectively known as oligoasthenoteratozoospermia syndrome. That brings us to the end of this video. Thank you for watching.